Welcome to the Futurist Society podcast, where we delve into the latest advancements in technology, science, and culture. From discussions on the latest breakthroughs in AI, biotechnology, and space exploration, the Futurist Society is your window into all of the awesomeness that the future holds. Get ready to be informed and inspired as we consider the positive impact of emerging technologies on humanity. Without further ado, welcome your host, Dr. Awesome.
Hi, everybody. Welcome back to the Futurist Society, where we are broadcasting from the present, but talking about the future. Today, we have Eberhard Scheuer, who is a leader in the crypto and blockchain space. He's doing some interesting things with translating the technology of blockchain and cryptocurrency into the healthcare space, which I think is really interesting. Can you tell us a little bit about what you're doing, Eberhard, and how it is going to make the future better for us?
Yeah, first of all, thank you for inviting me. And maybe I have to kind of go back where I come from. And so that might explain what we're doing, what we are doing, actually. So I'm a psychologist by training. And so I was working in research. And what always struck me is that people are not interested in their health data. Everybody does collect health data, like the industry, researchers, but the ones who are producing the data are not interested in that data. And that is my experience in working with patients. So that's when we started thinking about how could we incentivize people to collect their data, tend to their data. So because at some point in life, we need them when we get sick. And it only shows that when you look at the research, that people are only interested in their data when they are actually sick themselves or somebody they know suffers from some disease. So when we started, we thought about incentivizing people for collecting their data. And this is how we started out. And knowing from psychology that incentivization through tokens, that's a small step to crypto tokens. So, and being in Switzerland, near to the crypto valley, somebody asked me in 2016 if we could do something on healthcare and blockchain. That was the start. And at that time, we just were giving people tokens when they shared their data. But then a lot of things happened. The pandemic came. And we started to do many different things like tracing of vaccines and also outbreak detection together with a large pharma company. And so we decided 2 years ago that we will focus on blockchain infrastructure to make it accessible and as easy to use as possible for the healthcare crowd, because blockchain has some big advantages and also disadvantages compared to traditional storage solutions, but it's still hard to use the technology. Even if you are in crypto, it's hard to build decentralized applications. Not even talk about people who come from the centralized world, working in healthcare where everything is centralized. You have medical centers, you have insurance centers. So everything is centralized. Traditionally, also the data is centralized, and bringing them to a decentralized world, that's currently the challenge that we're facing. And we're trying to make it as easy as possible for them to use the blockchain components that you need in order to interact with an existing blockchain and also take advantage of blockchain technology. And that's basically what we are providing. And you can also call it Web3 components, everything that helps to decentralize data.
Yeah, I mean, I think that this idea of blockchain revolutionizing so many different industries is something that you hear about a lot. But everybody's idea of blockchain comes from the cryptocurrency space. So what are the benefits of blockchain to some of these other industries? Like, what is the benefit to the medical industry? Because I think that when people look at blockchain and they think of its capabilities, they're thinking of it as a speculative asset, right? Something that it's like it has the potential to change finance, but it hasn't really gotten there. It hasn't really gotten the mass adoption. And then, they're just like the peaks and valleys kind of make people who are not in the industry a little bit scared about what blockchain is. How is that going to be changing healthcare? How is that going to be changing other industries, in your opinion?
The only industry where it's being applied right now is the financial industry. And as we see by the reaction of the SEC trying to put their boot on it, it's definitely a threat to existing banking industry. So, but it all comes from the idea of decentralization. And what does it mean? I mean, if you look at Bitcoin, and most people just mix up Bitcoin and blockchain, whereas Bitcoin is just one financial application using blockchain technology. But what does it bring? It brings peer-to-peer interaction. In finance, it's that I can send you a digital asset without having to ask my bank to check if I possess enough digital assets, and then also taking a fee from the transaction. So I can directly send you something without someone having the opportunity to interfere with that transaction. So that's the decentralization part of that blockchain brings. And it's transparent. Every transaction is on the blockchain. It can be seen there. If you know what it is, that's a totally different story, because if it's an encrypted transaction, you can see it, but you don't know what it is. So it can only the one who sends the transaction does know who is the recipient and what is in the transaction. So if you take that as the basis of the disruption, peer-to-peer interaction, transparency, and immutability, that's also something that's very important, because you cannot change what's on blockchain. And that's actually the basis of digital asset transfer, because usually you can copy a hash multiple times, but Bitcoin is also just a hash. So I don't want the inflation to happen by people just copying Bitcoin many times. But what the transparency of the blockchain brings is that you have a history of transactions. So actually through that history, I can prove that I possess, for example, a Bitcoin, and then that I'm allowed to send it to you. And so everything that's in my wallet balance has been derived from the history of the transactions on the blockchain. So that's the transparency part of it. Decentralization, transparency, and immutability. And that's basically all that is there in the blockchain, and you cannot shut it down. What does it mean? It doesn't have like a central authority that governs the whole process of transactions. If you think about Bitcoin, nobody even knows who the guy or the woman was or the person was who invented Bitcoin, but it still runs up to the date without no single minute downtime. And that shows that this is possible to have like a decentralized organization that runs without a central controlling entity. So in the finance area, this is, we can say a bank is a central authority controlling what's going on. In the healthcare space, who could that be? That could be an insurance. If I look at the US, which is the most expensive and probably most inefficient healthcare system in the world in terms of life expectancy of its citizens, then you have the highest costs, and who takes out the costs? or the profit that's not you as a doctor or the hospital. Some of the hospitals do, but it's very often the health plan providers, the insurances. In other countries like Germany or Switzerland, their profit is capped, so it's not as bad as in other countries, but still there's a lot of administrative overhead that's out there. And what if a decentralized healthcare system could get rid of us of those centralized administrative processes?
Mm-hmm.
For example, I think you're a
surgeon
who also does
maxillofacial surgery, yeah.
Also with teeth, so with your jaw.
Mm-hmm.
So we had a discussion with American pediatric dentists, actually. They wanted to do a health plan on blockchain. And what's the difference to a traditional health plan? Is right now I pay for a health benefit plan and I have no control over how that money is being spent. And the only thing that an insurance does is it collects money on the one side and distributes it according to certain rules, regulatory rules on the other side to the healthcare providers. So what if what the insurance does can be governed by a so-called smart contract? That's a set of rules that's also on the blockchain, so nobody can change it. So the parties who entered that contract, for one, it's transparent what that contract means, how the money is spent under which condition. So how could that work? And how could that save money? For example, parents pay for their children health benefit plan that say they pay $50 for a year, and then the contract says if they brush their teeth properly, then the cavity is being fixed for free, and the likelihood of a cavity occurring is very low if they brush their teeth well. So you have that money coming into like a liquidity pool on blockchain. You pay it as a digital currency on blockchain. And then there are the rules, how good you have to brush your teeth. You can scan it with an AI tool that gives you a plaque score. That plaque score is written on a blockchain, and that triggers a smart contract in the case of a cavity that has to be fixed. And that smart contract has the value of your plaque score, and then it has the demand of the doctor for the payment, and it's being released or partially released depending on how good the plaque score of the child is. So you know what you pay in, you know what you're getting, under which conditions, and there's no human being in the middle that has to touch that at all and has to make decisions. And you can even implement a rule that says if there's no cavity at all, you get a 50% refund from that pool. That, by the way, would incentivize patients to brush their teeth well or tend to their health.
Yeah,
that's an application that we foresee in the future to happen.
Yeah, I think it's a good thing to get a lot of the middle management out of healthcare. I think it's become, especially in the US, a bloated industry. It's something that I hope the blockchain will affect. My concern is that the smart contracts are going to be manipulated by the insurance companies. You know, I think that when I think about decentralization, I think that it's a nice concept, but those people who are the central repositories of information or power or whatever, it tends to skew towards their favor, right? Like, for example, Bitcoin. You know, Bitcoin has not been the power to the people, changing the world finance system that it was. And now the people that, are Bitcoin millionaires tend to be a certain sector of the population, right? And I'm in the business of getting coverage for my patients, and I can't tell you how many times I have to get a denial, and then I have to call somebody on the phone, and then I explain the situation, and then I get an approval. So, I think that my concern is just that it becomes almost too automated. What are your thoughts on that? And am I just thinking catastrophically about this? Like, how would it be better with blockchain in place?
Well, first of all, I have to agree that nowadays the original idea of cryptocurrencies slash Bitcoin has not been achieved. I mean, people talk too much about making money instead of trying to use the technology to improve the system. So I totally agree that this has gone into a direction where for me, it doesn't make sense anymore. And it's more centralized than you think, because there's a couple of big players out there controlling large amounts of Bitcoin. But nevertheless, the infrastructure, is clear, and a smart contract per se, if it's on blockchain, it's transparent and cannot be altered. And everybody knows what you're entering into. And so if that's something that you see doesn't bring me any benefit, there's no need for you to enter into that contract. And especially in dentistry, which is a lot of out-of-pocket payment, I can choose. And as long as it's transparent and there are several providers, I can choose who I want to do business with, or which contract I would enter. I mean, currently what you described is basically the current system. And this is a little bit who controls the data also controls the system. And if we stick with dentistry, but I think it's true for all of healthcare, if who owns the data can see, okay, what are the risks of someone becoming ill? How expensive is this patient going to be? But what if, and let's take dentistry as an example. I mean, right now, when I go to my dentist, he takes a scan of my teeth. I don't get a copy of that scan. So they own it, or legally I own it, but they are the custodians, and most people will not question that. So they recommend a treatment to me, in Switzerland, quite expensive. So, and lots of people can afford it. So there's no need for me to question that. But what if I have a copy of the data? I can even leave the original with the dentist, but what if I have a copy of the data? In a market where it's all out-of-pocket payment, I have the freedom to decide where I want to go. And I can, if I have a copy of the data, I can get a second opinion for a cheaper treatment. And right now that's not possible. And that kind of exemplifies the power of the data in healthcare. And unfortunately, and coming back to where we started, a lot of people don't see that, and they're not even interested, or they don't have the means of controlling their data. If I ask a dentist, they will send it a JPEG via email. That's the current state of digitization we're talking about. And that's usually not what is happening. So here in Europe, and I would assume also in most industrialized countries, the data sits with the large stakeholders in healthcare and not with the users / patients. And I think, and that's basically what we are working on, is that if you own your data or have at least a copy of the data and can share it with whoever you want to share it with, you are in a position where you're not totally dependent on the existing healthcare providers.
Yeah, I mean, I think that's the ideal. Ideal is to control your own data. And certainly right now, I think that if we were to look at any sort of technology that would benefit from blockchain, I look at it as records, record keeping in general, right? Like electronic medical records is something that I think is just such a low-hanging fruit for blockchain to revolutionize. But for whatever reason, I think that people have this idea of blockchain and it's a negative idea. And I think that when you're talking about owning your own information, uh, I think that's the goal, right? That's the goal for every industry. What are some other industries that you think that blockchain might, like, let's take a bird's eye view of this thing. Finance was the first iteration. Hopefully it goes into medical records, like you're saying. What are some other industries that you feel like would benefit from blockchain technology?
Well, everything around logistics.
Mm-hmm.
I think that's really the low-hanging fruit in blockchain, and that can also lead us to healthcare. But I mean, why is logistics such a low-hanging fruit for blockchain? It is you right now you have to log into a system, record that a parcel has arrived, and you have to share that information with other players in the supply chain. So if you take vaccines, I mean, taking healthcare as an example, I mean, pharma industry, and that's really where some of the larger companies are working on. So why logistics? So there's a place where something is created, let's say a vaccine, and then you scan it, and that's information is being written on blockchain. And since it's publicly available, it can be seen by the other participants in the supply chain. For example, the one person or company that will receive the parcel or the goods, they see, okay, now it's being out of the company in Basel, for example.
Mm-hmm. Yeah, in transit.
Yeah, and if you right now with the big corporations like FedEx or DHL, they have their proprietarian system, so they have to maintain their own IT infrastructure. They have to do the access management to the data. So they have large records of people there, some very easy to be hacked or very attractive to be hacked, very expensive for them to maintain as an infrastructure. And you can do that if you are a small hospital, or the vaccine case I'm talking about is with the Swiss Tropical Public Health Institute, and they have asked us to do a project with them in Western Africa. So they don't have the money to build up large infrastructure. And the main reason why they asked us to help them with blockchain was the transparency of all the people involved without having to build up an extra IT infrastructure.
Right.
Because writing blockchain is quite easy. You can, there are tools to do that. Reading a block, writing actually costs something because the transaction has to be written and disseminated over all the different nodes that hold a copy of the blockchain and the distributed system or decentralized system. But reading the blockchain is free. Everybody can do that. And so every part in that logistic chain can read this transaction. As a matter of fact, in a public blockchain, everybody can read that transaction. But as I mentioned earlier, if you don't have the key to decrypt that information, you don't know what the transaction is about. But the partners in that supply chain case, they all have the keys to decrypt it, the information that they are allowed to see. And so that's a simple case without having to build up large infrastructure, and it can be deployed in a couple of days, actually. And
So are you finding that the majority of the clients that you work with are logistical in nature? So they're in the medical space, but they're asking you, to use blockchain for logistical reasons, like for example, vaccine delivery and things like that?
As I said, that's the low-hanging fruit. That's not the
Yeah.
majority of our partners, but that's part of the inquiries that we are receiving. Plus,
What
you
are
can make.
your
Sorry.
partners? What are your partners using blockchain for? Like can you give me like some, like what's like the most common example?
The most common example is still payment processes.
Yeah.
For example, cross-border payments. You can also make sure that the person that's supposed to receive the payment actually receives the payment, which is an interesting prospect for relief organizations giving money to, for example, financing 10,000 treatments in Africa. And then they can really track if the money that they put in has received the person that's supposed to receive the funds.
Mhm.
That's still payment is still the most common case. And I would also think in the future that if you combine that with stable coins, that's a huge business case and a huge opportunity to get rid of administrative costs, especially also in healthcare. Logistics is some of the project ideas people have that come to us. And interestingly enough, most inquiries come from emerging markets where the population has leapfrogged to the mobile phone, where there are not so many established infrastructures. It's always hard to establish some new technology in a market that's already saturated, like the US or Switzerland. It's much easier to implement something new in countries where there's a need, but they don't have a solution yet, which is can be that supply chain case.
Right. So how did you get into all this? I mean, you said you're a psychologist by trade. This seems like a very different industry. Like what brought you into blockchain?
Well, first of all, at some point, I mean, I started as a research psychologist,
Uh-huh.
and then that's always a lot of computers, number crunching. So the affinity to data was always there. And then the realization that data is not collected by those who should collect that data, coming back to the personal health record issue. And then I got that phone call from one of the founders of Crypto Valley here, who I met many years ago in the US, actually on the Empire State Building. And he was asking me in 2016 if I'm still in healthcare. And I said, yes, I am. At that time, I was still as a consultant working with one of the large telecom companies. And before, I was head of eHealth at the University Hospital here in Zurich. And so that's how the idea came to life, that you start to incentivize people for sharing the data. And that's not so far from behavioral modification, because in the end, that's what you're doing. You're trying to modify their behavior, i.e. not collecting data to collecting data. And the concept of token is very common in psychology anyway. So a token is something that's backed by value. And how do you use token, for example, to motivate your kids to clean up their room, to do their homework, to do the dishes? For example, you give them tokens, and that could be like a red dot. And the red dot the red sticker doesn't have any intrinsic value. But if you say, okay, if you collect 5 red dots, we go to the movie theaters, that's a motivation for them to do what you asked them to collect the red dots. And that's a little bit the same principle that I envisioned for collecting health data. We give them the tokens, which in return they can use to redeem certain services. And that's actually one of the legacy projects that we're having. Actually, it's on hold because it's in Ukraine, where rare disease patients monitor their treatment through an app that interacts with the blockchain. And blockchain is there to do two things. For example, incentivize them when they share the data. In that case, it's hemophilia patients sharing the bleeding rate per week. And once they share it, they get tokens, which they then can use to redeem certain services in the system. And the second reason why we apply blockchain there is that we protect the identity of the people, because they only live there as a key, as a public key, or and that's all the other people who process the data. We are not processing the data, and that's part of the decentralization, that by principle we are not collecting any data ourselves. Our partners do with the help of our blockchain, but we don't. So privacy is protected, and blockchain is also a prime example, use case, incentivization, giving them a crypto token, can be also called cryptocurrency if it's tradable and exchangeable to fiat currencies like US dollars. But that's the setup, and that's also how I got into the whole issue of blockchain.
So are you using that data for anything other than just like the intentional use? Like one of the things I think that is like a big fear of just the idea of data in general is that somebody's going to use my data to profit or to, cause my life to be negative in some way. Are you able to do that with blockchain, or is because of the encryption, are you like protected from that?
Well, nowadays, what you describe is happening because you give your data to some centralized organization, can be a hospital, can be insurance, can be Facebook, whatever.
Mm-hmm.
And you give their data, and you have to trust them that they handle your data well. And if they change their business, you might lose the access to your data. And actually that happened in UK with Google and the NHS, that they promised never to use the patient data that they collected or that they were storing for their business. And then at some point it came out that they used the patient data for their core business, which is advertising. And that can only happen if you give your data to someone and you have to trust them that they tend well to your data. Most organizations do that, but you always have to trust someone. In a blockchain / decentralized world, you only have to trust yourself, because I'm the only one who is the gatekeeper or the custodian of my data. And then, of course, I can share the data, or I can have them look at my data without actually physically sharing a copy of the data. And for that, I have to give them the decryption key. So, but it always has to go through me, and I know when someone wants to see my data, because I have to approve it, and otherwise they cannot see the data. And that's actually what they're doing in Estonia. For many years now, they use blockchain for identity management and data access management. There's no piece of data written on blockchain, but the access to the data is governed by a blockchain solution. And to address the fears of people is blockchain is actually a good technology to protect your data, because without the keys that you can give out, nobody can decrypt your data.
Yeah,
And
I think that's one of the benefits of it is the privacy aspect. I feel like many people worry about privacy going forward because it seems like we're getting less of it as we become a more connected society. But I think that that's one of the biggest benefits I see with blockchain is just the privacy aspect. And I hope that that's something that is able to be kept under control because there's such an incentive to use data. And that's honestly one of the things that I worry about is that maybe because of this, you know, people who are doing studies and research and stuff would have less access to data, because right now they can just talk to an electronic medical record company and get every single, you know, heart attack that happened in this particular hospital system very easily. Like that's one of the things I think that the artificial intelligence community is really looking forward to, is just the ability to predict issues before they happen, and getting the data from these large medical record companies to drive the algorithms that predict things preemptively. So, you know, I like the idea of privacy, but I think that I still want those entities to also have access. So do you think that that's going to be possible? Do you think that that's going to be probable?
Well, the reality is that we're not going to change healthcare overnight. I mean,
Yeah.
And we cannot replace the existing system with something new. If it happens as a gradual process. And the way I see it, the silos that are out there, like Epic or insurances or doctors' systems, they will continue to exist. We are not getting around it. We're not changing that, at least not in the last, in the next 5 years. So, but we can gradually motivate people to get a copy of the data. In the US, you have HIPAA, you have people can get their a copy of the data for themselves, but the original of the data will remain in those silos. And that's okay, because very often they need it for regulatory reasons. But you get a copy of the data, and you're the only one who can actually consolidate the data from different silos. And a silo is a clinical information system. It can be an insurance. It can be my Apple Watch. I mean, those are data. If I combine them, there's a very holistic approach to my life based on the data. That's actually what a lot of big tech companies try to get their hands on. And I think
which is a good thing and a bad thing, right? Like, I think that that's a good thing and a bad thing. In the same way that blockchain is a good thing and a bad thing. The idea of like the data being out there and for tech companies to use it to benefit us, I think is something that's a future that I want to live in. I'd love to have somebody looking at my health data and saying, hey, listen, like you need to change this behavior so that you can live longer or something like that. And I think that we're on the verge of that. And I feel like when we're talking, blockchain is like mutually exclusive to that, but I hope that that's something that they can find some sort of reconciliation.
Well, I think there's one fundamental change or difference from the current system. And I agree that I want like a companion that tells me how I can be more live more healthy, or that warns me you should go to the doctor because your heart is having some arrhythmias. I would appreciate that. But nowadays, in order to do that, someone has to collect the data and be the custodian of the data. And that's now it's the Apples of our Amazons of this world trying to get into that business, because healthcare is such a large industry, and if they want to grow, they cannot grow in their home territory. They have to enter new markets, and healthcare is out there to be conquered. But the fundamental difference between the centralized world that we just looking at and the decentralized world is that I don't have to give my data to someone.
Mm-hmm.
I'm the custodian of my data, and then I can expose my data to algorithms out there without having them to have a copy or own a copy of my data. I think that's the fundamental difference between now, where I have to give my data to someone. I need to trust that they're not messing with my data. And the future and the Web3 area, we don't have to call it blockchain, let's call it Web3 area, is that I have my data and I ask the algorithms to come to my data and tell me what's wrong with my data. Simple example can be your vaccination record. Now you have to give your, and that's actually happened in Switzerland, that there was a solution by the central government where you could record your vaccine shots. And the idea was also in the future, there's a bot telling me when I have to get a booster and so on. And a lot of people did that. My wife did that. 500,000 people in Switzerland did that. And then it got hacked. So you could manipulate the data of people. You could look what famous people had for as vaccines, and then they shut it down. And that's the risk of a centralized system.
Yeah.
There are lots of data sitting there, and if you exploit that, a lot of people are affected. On the contrary, if I, in decentralized world, I record it on my side, and then I ask the bot, or I can share the data with my doctor when he needs it or she needs it, with giving them access to my data. And that's not so attractive for hackers because they have to hack every single record, and that's just not interesting for them. And that's the big difference. And one other difference, you mentioned you want that someone is analyzing your data and giving you recommendations. Right now, data is being monetized, and a lot of AI companies build their intellectual property or their algorithms on owning data. And I, who give the data to them, or the hospital who's giving my data to them, actually here it's not allowed to do that. They're trying to change that, lower the thresholds of data privacy. And I'm not being asked. And I don't even get a notification that someone is using my data, and I'm certainly not part of the monetization of the data. And let's be honest, I mean, they don't do it for the sake of helping us. It's
To profit.
They do it to profit. Yeah.
Yeah, they profit off us. But you know, I do think that there's a lot of good in what you said today. We are getting to the end of our time, and you know, I feel like we did a deep dive into blockchain and crypto, or maybe a superficial dive for someone like yourself. But certainly, it was a little bit more conceptual than I initially thought. So I just wanted to talk to you and ask you a few questions, which I do with all my guests at the end. You know, first off, this is a really technical field, and it's sounds like you're have been doing this for a long time. What got you here from a motivation perspective? Like for me, science fiction is something that really gives me a lot of hope for the future. And what are some things, maybe if it's science fiction or movies or literature, that really give you motivation in what you're doing?
Well, there's no specific science fiction series like Star Trek with the Visor or something that brought me to that area. I think it's curiosity and always trying to do something new that brought me to the field. And yeah, that's still driving me to date. And also seeing that healthcare is such a slow-moving industry, and having worked there for decades, I think we have to solve some of the issues that became apparent during the pandemic in terms of digitization, or the lack of digitization, to solve that. And that's still driving me today.
That's cool. One of the things when you were talking a lot about reminded me a lot of the cyberpunk genre of science fiction, where data is such a big part of our lives. And I think that it's something that has become relatively popular in the past few years. So I would definitely check it out if you have an opportunity. But anything in the cyberpunk genre, I feel like fits with Bitcoin very well, because data is such a commodity, and the ability to be online and have access to the internet just drives society in such a way that it's almost like a commodity. It's like a right to have. And I think that that's where we're on the cusp of that for sure. Wouldn't you say? Don't you feel like we're like, most people look at internet as like a right these days?
Absolutely. I mean, if I talk to my kids, they cannot imagine that I grew up in a world where there was no internet. So
Mhm.
it's kind of a remote concept for them. But what you mentioned, cyberpunk, that's something where the roots of blockchain technologies are. And one more thing, if you talk about data about us, that brings us to like a digital twin of us.
Mhm.
I mean, some people have thought the metaverse will be the next big thing. I kind of doubt that, but in a sense, we already have the digital twin of us living in many places or in those silos, especially in the healthcare system, where there's a lot of data collected about ourselves. And
Mhm.
I think at some point we should not leave the digital twins out there. Without us knowing what's happening to them, but we should be the one basically consolidating all the different twins out there of
Mhm.
us. And maybe, I mean, look into the future, that data can be used to increase our life expectancy. And as some people, I'm sure you also know that, think about longevity or eternal life, that could be that our data live forever and have their own mind and feelings and so on.
Yeah, I mean, I would prefer the biological component. Actually, next week I'm talking to a gentleman that is working on, the whole concept of longevity. It's something that's very in vogue right now. People like you and me that want to live to be 200 years old. So that's something that's coming for the next podcast for whoever's listening. But the fact of the matter is that I do think that having digital twins would be cool, and hopefully it could be something that allows us to make better use of our time. A lot of these like mundane decisions that we make, if we could, give that to somebody else, I think that would really make our lives better. Okay, so second question: the idea of blockchain is something that is still relatively new. In your head, other than the finance space, what do you hope to see in 10, 15 years that blockchain has done to society? Like, is it the idea of decentralization, the main thing, or is it the idea of, having privacy the main thing for you? Where do you hope that the industry goes in the next 10, 15 years?
Well, for one, I would hope that it brings me autonomy, independence, that I can make my own decisions on not just who I want to send money to, but who I want to have access to me or my data. But what we're seeing right now is that the hype of blockchain kind of is fading away and everybody flocks to AI. But I just found a picture of me talking in 2018 about blockchain and AI, so in Berlin. So I think the combination of those two mega hypes are actually an interesting prospect for the future, and we don't have to look into the future for us too far. I would say that in a couple of years, that's actually a common technology basis that we can use for our data. And
That's
actually,
actually,
what
that
can
was my third question I was going to ask you about, which is how AI and blockchain could work together, and what are some potential applications with that? What do you think about that?
I think that's great. For one, I mean, the low-hanging fruit is if I commit my data to train AI. So right now, most AI is trained on stale data,
Right.
not personalized. But the idea would be that we would feed like an AI doctor or senior physician with that real-time, real-life data and improving the outcome of the decisions. That's one thing. And the other thing is that we make it transparent what AI does. Right now, AI is a big black box. And that's okay if I ask ChatGPT to write me a business plan or something like that. But is it okay if my life depends on the decision that an AI is making? The black box is not so good in that case, especially if something goes wrong and you have a liability case at your neck. So you want to prove, for example, as a physician, that the AI you were using came to the conclusion due to that. And that can be written on blockchain as to give you as a doctor who uses that application the safety to show why this decision has been done. I mean, locking the decisions. And I think that's making it transparent and also making the decisions auditable. That's what blockchain can bring to AI and the combination of those two.
Yeah, that sounds cool. Well, thank you so much for joining us today, Eberhard. It was really nice speaking with you about all the different applications of blockchain, especially what you're doing in the medical space. I am Dr. Awesome, and I look forward to speaking with the rest of you guys in the future. Have a great day.
We appreciate you taking part in today's episode. Take this chance to reimagine a better future by joining a community of futurists who strive for a remarkable world. Be a part of this growing network and contribute to making the world a more positive place. Visit thefuturistsociety.net and subscribe to the show so you don't miss a drop of hopeful futurism.